Did you know that 25 million men estimated in this country are suffering with erectile dysfunction? This is a huge number, and it's not all older men either. As a matter of fact, there are many younger men who suffer with erectile dysfunction. There's a rumor that, once men approach a certain age that they're going to have erectile dysfunction. And it's not an age thing. It's more of a process of disease setting in as men age, okay? So that's why you oftentimes see the higher number of erectile dysfunction issues in older men. However, don't let that fool you, because men at any age can have erectile function issues, okay? I have seen men younger than, 18, 19 years old, or around that age, 17, 18, 19 years old, who are dealing with this issue. So it's a big issue for men, and men have a real issue talking about this because of embarrassment. Not only that, men oftentimes feel as though they can take care of the problem on their own, or the problem will just disappear, and it doesn't, unfortunately. This is something that can be a medical issue, it can be a psychological issue. So I want to talk a little bit about just the physical issues versus the psychological issues. The physical issues of erectile dysfunction can be anything from neurological issues, obesity, alcoholism, cardiovascular issues, medications that individuals take, blood pressure medications, those types of things, Xanax oftentimes. Some antidepressants can affect erection function. So there's a host of physical issues. Another one would be something called venous leakage, where the blood flow doesn't flow back out of the penis, so it's very difficult to obtain and maintain an erection strong enough for sexual intercourse. On the other side of this is this psychological piece. And a psychological piece to erectile dysfunction oftentimes revolves around performance anxiety, or just in general anxiety. Depression issues, what else? Relationship issues, anger, frustration, hostility, resentment is a big one. So there's a lot of psychological issues that are wrapped up in this as well. And again, it's not always combined, but oftentimes it is combined, the physical and the psychological. One of the first things that I have my male clients do as I deal with erectile dysfunction often in my practice is I will have them go see a urologist, okay? Because I want to know if everything is okay from a physical perspective before we even start working on the psychological aspects of these things. Here in Delaware, I work with a couple excellent urologists, and if you're not in Delaware, you find a urologist that has a good reputation in your state, and you go visit them. One of the things that I want tested is testosterone, okay, which low testosterone levels can impact this as well as high prolactin levels, which acts as an inhibitor in the body. So I want those things tested, and as well as what your urologist will do some other exams that will help to rule out some physical issues, blood test, checking of manual checking of veins in the penis, to check for any type of venous leakage issues or anything like that. If there is a clear medical bill, then we start working on some of the psychological stuff. Looking at things like the history of the erection issues, okay? When did they start? Are they just with your current partner? Did you have them for lifelong since you started being a sexual individual with regards to actually sexual intercourse or being sexual with a partner? Then we look at, anxiety issues, we look at time management issues, we look at depression issues, we look at diet and exercise. One of the things that I want my males to do, without a doubt, is get on a exercise routine. And one of the things that I find very often is that men who do have some erectile issues that are not physical, oftentimes don't exercise very much at all. So their blood flow, in lack of better words, stays sort of stagnant, okay? So I put my men on exercise routines at least 3 times a week, cardio for at least 45 minutes. And, obviously there's going to be different extremes to that, based on what individuals can do. If it's just walking, if you're a 65-year-old man and you can't run or don't feel like you have the energy to run, then I want you to walk. If you're a younger person and you can run or jog, I want you to start doing those types of things. I also want the diet changed because oftentimes, we obviously live in a world that, is fast food nation essentially. So, oftentimes what we're putting in our bodies isn't helping, our functions of our bodies, not only with erectile function issues, but a whole host of other different things, which is a whole other segment on, diet and sexuality. So it's a process of really clearing up what's going on in this individual's life, and every individual is different. For example, there may be relationship issues in one individual and anxiety issues in another individual. Each individual is treated in a different manner based on that person as a whole, looking at their lives as a whole as well. Erectile dysfunction, is a very manageable issue, and it can absolutely be cleared up, if you will, okay? And we can learn techniques to actually help an individual to obtain, and for that matter, maintain the erection through sexual intercourse. Just a brief exercise, which a lot of people know currently, that helps with not only erectile dysfunction, but will also help with stronger orgasms as well as premature ejaculation issues, is the Kegel exercises. And though this is a pretty common knowledge at this point, it's imperative for men to be doing Kegel exercises. And the best way to do them, the easiest way to do them, to learn how to do them, is through urinating, stopping your flow of urination, and then going again, stopping, going, stopping. And this actually helps to strengthen the pubococcygeus muscles, okay? So this is imperative. That's a very sort of beginning process before, all of this other stuff. And as far as I'm concerned, men and women, for that matter, should be doing these things, or Kegel exercises, every day for the rest of their lives for pelvic health, okay? That's really important. So there's more information about this, obviously, online. You can also purchase one of my manuals on erectile dysfunction. You can visit DelawareSexDoc.com or DelawareSexTherapy.com. Also, I talk about these things on Twitter, and you can follow me there at Dr. Deb Lane.